Hi, I'm Lisa Beckendorf. I'm a pancreatic cancer survivor and a cancer research advocate.
And I'm Stephen Merlin. I'm also a pancreatic cancer survivor and a cancer research advocate. We would like to tell you about an important clinical study that is comparing pancreatic cyst surveillance approaches to help prevent or detect pancreatic cancer early. Lisa, to start, can you talk a little bit about pancreatic cysts and what they actually are?
Sure. Pancreatic cysts are growths in the pancreas that are filled with fluid. They occur in about 20% of the population and are most common in older adults. Most of these cysts do not turn into cancer, but a small percentage of them do. So it's important to monitor all people with pancreatic cysts. They're usually identified by chance on imaging that may have been performed for other purposes. My pancreatic cancer was also found by chance during an exploratory surgery. Monitoring of cysts may be done by CT or MRI scans, or sometimes by a special imaging test called an endoscopic ultrasound.
How often do patients need to have these scans or tests?
Right now, doctors regularly use one of two standard surveillance schedules to follow patients with pancreatic cysts. While both screening schedules follow patients closely, one suggests more frequent use of imaging tests than the other. Both work well, but they have important differences in cost, convenience, and potentially outcomes for patients. At this time, doctors do not know which of the two standard screening schedules is better. That is why researchers are conducting the EA2185 study to discover which schedule is best and learn how to help patients in the future.
Who can participate in the EA2185 study?
You may be able to participate in this study if you are between the ages of 50 and 75 and have been diagnosed with at least one pancreatic cyst. Your cyst must be at least 1 centimeter or larger.
What should patients do if they are interested in participating?
If you have a pancreatic cyst and are interested in taking part in EA2185, ask your doctor about the study or email EA2185@ECOG-ACRIN.org to assist in finding a local chapter where you can participate. Your local center will review the requirements for participation and will provide you with the possible benefits and risks. This process is known as informed consent. If you decide to participate, you may change your mind at any time, even after you enroll, for any reason.
What happens when someone enrolls in the study?
Patients in the study will be randomly assigned by a computer to one of two surveillance schedules, both of which are standard practice at this time. In the less frequent group, patients will undergo MRI or CT scans every 1 to 2 years, depending upon any changes that might occur in the cyst. In the more frequent group, patients will undergo MRI or CT scans anywhere from every 3 to 6 months to every 2 years, depending on changes in the cyst. In both groups, changes in the cyst size or appearance may lead to an endoscopic ultrasound or other appropriate care. All patients will be followed up by the doctor for 5 years.
What should patients consider before enrolling? What are the benefits and risks?
The main benefit is that participants will help doctors understand which approach is better for patients with a very common and worrisome problem, pancreatic cysts. Because each monitoring strategy uses the same tests, the risks of both of the surveillance strategies are the same.
How will the results of the EA2185 study help patients moving forward?
The results of this study will shed light on whether a less intensive monitoring schedule produces the same results. It's an important step forward for early detection, and if it can be easier on the patient, even better. Prevention and screening studies are critically important, as it is far easier to prevent cancer or treat it early than it is to treat advanced cancer. This study has the ability to make a significant mark on patient care. And at the end of the day, it's about making sure patients are getting the best care possible.
Thanks, Lisa. For additional information about this study or to find a participating site near you, visit the link on the screen or speak with your doctor.